In this video section, we're going to learn how to attend to patients. That is the button here. Of course, before you can get to this attend to patients, you must have logged into your account as a healthcare professional or supporting staff. This attend to patients is the most important function in a professional and supporting staff system. Why is it most important is because everything you want to do in a patient folder, you must use this button to retrieve that patient folder, either to document new information or to update the patient information in the system, or even to create dependent patient in the patient account. So there are actually 5 options to do this. The number one is attend to patient via fingerprint. This is very important because if you profile a patient in a particular institution, in the event of an emergency, it will be easy to identify the individual and retrieve the patient folder without any clue from the patient. The other option is to attend to patient via existing Otp and to attend to patient via SMS Otp. The fourth one is attend to patient via credential, and the fifth one is to attend to patient via their phone number. Now, let's start with attend to patient via fingerprint. These attend to patient options are very easy to use. So we start here. You click on get started. You get to this interface. So at this point, you click on collect fingerprint. Once you click on it, you now ask the patient to thumb on this device, which I have here, which is this device. You ask the patient to put their thumb on this device twice. So I'm going to do that again. So I now place my thumb, I repeat it again, and then I click verify fingerprint. So this system will automatically search to identify who this individual is. And now he has completed that process. He has said that he's a John for John color. So, and at the same time, it generates a code that can be used to retrieve that patient folder. So if I click on get patient folder now, it will return the folder of this patient. So I can now document and do whatever that needs to be done in this patient folder. Now that pop-up came because I'm using this webcam to record this video. So the webcam on the system is not available for the HealthServes at this time, and that is what is affecting the webcam operation. All right, so if you see it now, you can see all that has been done in this patient folder by previous clinicians. And for me to update this patient profile, I will simply click on update patient profile to do that. So I can change the image we stored there before. It can be changed. I can update all the information about this patient here. Once I finish doing that, I click on update patient profile. And to add fingerprint, if this account has not been profiled before, I click on update user fingerprint. And this interface will pop up, and I will capture the right and left thumbs, and then the fingerprint will become active. So let me go ahead and do that. So I simply place my thumb on this. I place it the second time to confirm it. Then I'll go to the other one. I'll do the same thing. I repeat it, and then I'll click update fingerprint to profile, and automatically the process is completed. So now let's go back to the patient folder and see another option to do this. Remember, for me to create a new record on this patient folder, that is the button to use, create new record. But before we do that, I want us to try another attend to patient option. So we have used fingerprint. Now let's use existing Otp. Now this existing Otp means that if you have generated an Otp for this patient before, you can use that Otp here as an existing Otp to attend to this patient. But right now, we don't have any generated Otp. But there's another way to get an Otp. Another way to do this is that every patient can have their account logged into their system, be it computer or phone. So they can generate an OTP from that end as well. So let me go ahead and use that option to do it. So you talking about existing OTP. So to do this, I will simply put the patient user ID, and then I'll put that's the user ID I'm typing now. All right. So I have to add the OTP that the patient will provide to me, as I'm doing right now. So this is the OTP that has been gotten from the patient terminal of this system, because every patient have their own end of this system, because it's a two-way communication between the provider and the patient that we have here. So I click on verify. So I'm going to pull this patient folder using the OTP they provided to me. So, and I've done exactly that. So I see retrieve the patient folder using the existing OTP option. Now let's go ahead and use another option to attend to patient, which is SMS Otp. But for this purpose, I'm going to use the patient user ID that is tied to my phone, because this one will arrive to the patient phone that you can use to attend to the patient. So I'm using my own patient account to retrieve the folder. So once I put the patient user ID and I click verify patient ID, instantly a code will be delivered to my phone that I can use to attend to this patient. So the code has just arrived. So let me get the code, and then I can attend to this patient, which is 719 787. That is the code. This code, after using it now, becomes existing OTP. It can be used again if you still want to log into the patient folder again within a 24-hour interval. So I click on retrieve patient folder. So this will see get you the patient folder. So you can see the process is also effective. So now let's use the fourth option before we now use the last one. So this one is the credential option. All right. So all you need to do is to simply put the patient user ID and the corresponding password. And the good thing is that if you want to use it, once you use it once and you save it in the system, when the patient comes around, you simply key in the patient user ID and you don't need to ask for any password, you log in. So let me go ahead and do that. So the patient ID is already there and the password is already saved in the system. I'll simply click verify and I'll put this patient folder. It's as simple as that. So we have done it again, the fourth one. So you can see we have various options to actually retrieve a patient folder and do whatever that we think need to be done at that time in the patient folder, whether it's to create a new folder, to update patient profile, take care of billing, and even add dependent patient on that patient folder, as we have the button here, add new patient. You can use it to add the dependent patient. Let's say, for instance, a patient has children and you want to add children folder that are less than possibly 10 years, or as the case may be, maybe they don't, as long as they don't have phone number of their own, you can add that patient account to this. And there are also other scenarios under health insurance where we still have to add dependent patient, whether it's existing or new one. Now, the last but not the least is for us to see how to attend to patient via phone number. This is also very interesting because we know that some patients can easily forget this their user ID. So for that reason, there is need for us to have the phone number become equivalent to the patient ID. So for that reason, once you add the patient phone number in this interface, attend to patient credential with phone number. So once you use this option, which is attend to patient via phone, you simply click on the phone number and then the corresponding password, and you retrieve the patient's folder. So we have explored 5 options you can use to attend to patients in HealthServes electronic health management system. So in subsequent episode, we'll now be looking at what do we do when we retrieve patient folder. But of course, we can actually see quite a lot of information in the patient folder that can help us to provide informed patient management You can see so much that has been documented under pharmaceutical care and so many other information that will help us to track patient progress in the continuum of care. Thanks for watching.